Hello, everyone. How are you? It's nice to see you all today, and thank you, Jen, for that very kind introduction. As all of you know, we've come a long way in our fight against COVID-19, and we've come a long way thanks to the efforts of many, many people across communities in the United States. Right now, we are seeing COVID deaths markedly down from their peak in January. We have 160 million people who have been fully vaccinated, and hundreds of thousands of people each day are choosing to get vaccinated. That is all good news. But we are not out of the woods yet. Millions of Americans are still not protected against COVID-19, and we are seeing more infections among those who are unvaccinated. And that's why I want to talk to you today about one of the biggest obstacles that's preventing us from ending this pandemic. Today, I issued a Surgeon General's advisory on the dangers of health misinformation. Surgeon General advisories are reserved for urgent public health threats. And while those threats have often been related to what we eat, drink, and smoke, today we live in a world where misinformation poses an imminent and insidious threat to our nation's health. Health misinformation is false, inaccurate, or misleading information about health, according to the best evidence at the time. And while it often appears innocuous on social media apps, on retail sites, or search engines, the truth is that misinformation takes away our freedom to make informed decisions about our health and the health of our loved ones. During the COVID-19 pandemic, health misinformation has led people to resist wearing masks in high-risk settings. It's led them to turn down proven treatments and to choose not to get vaccinated. This has led to avoidable illnesses and death. Simply put, health information has cost us lives. Now, health misinformation didn't start with COVID-19. What's different now, though, is the speed and scale at which health misinformation is spreading. Modern technology companies have enabled misinformation to poison our information environment with little accountability to their users. They've allowed people who intentionally spread misinformation, what we call disinformation, to have extraordinary reach. They've designed product features, such as like buttons, that reward us for sharing emotionally charged content, not accurate content. And their algorithms tend to give us more of what we click on, pulling us deeper and deeper into a well of misinformation. Now, we need an all-of-society approach to fight misinformation, and that's why this advisory that I issued today has recommendations for everyone. First, we include recommendations for individuals and families. We ask people to raise the bar for sharing health information by checking sources before they share, to ensure that information is backed by credible scientific sources. As we say in the advisory, if you're not sure, don't share. Second, we're asking health organizations to proactively address misinformation with their patients. Today, the American Academy of Pediatrics is announcing an educational campaign to help parents navigate online health information. I'm encouraged to see this commitment, and again, this is just the beginning. Third, we're asking educational institutions to help improve health information literacy. We're asking researchers and foundations as well to help us learn more about how health information spreads and how to stop it. Today, the Rockefeller Foundation is announcing a $13.5 million commitment to counter health misinformation. The Digital Public Library of America is announcing that they will convene a set of librarians, scholars, journalists, and civic leaders to confront health misinformation together. Fourth, we are saying we expect more from our technology companies. We're asking them to operate with greater transparency and accountability. We're asking them to monitor misinformation more closely. We're asking them to consistently take action against misinformation superspreaders on their platforms. Fifth, we're also asking news organizations to proactively address the public's questions without inadvertently giving a platform to health misinformation that can harm their audiences. And sixth, we know that government can play an important role too, by investing in research, by bringing individuals and organizations together to address misinformation, and by supporting groups that are working on this issue. On a personal note, it's painful for me to know that nearly every death we are seeing now from COVID-19 could have been prevented. I say that as someone who has lost 10 family members to COVID-19 and who wishes each and every day that they had had the opportunity to get vaccinated. I say that also as a concerned father of 2 young children who aren't yet eligible for the vaccine. but I know that our kids are depending on all of us to get vaccinated to shield them from this virus. Every week, I talk to doctors and nurses across our country who are burning out as they care for more and more patients with COVID-19 who never got vaccinated, all too often because they were misled by misinformation. We must confront misinformation as a nation. Every one of us has the power and the responsibility to make a difference in this fight.